This is an overview of the cardiac catheterization section of the CPT codebook, and this is the 2020 Professional Edition. The cardiac catheterization section is, or subsection, I should say, is in the medical section of CPT. It starts on page 679 of the 2020 Professional Edition. And the beginning of this subsection includes a lot of information, guidelines about what can be reported with what, but this demonstration is going to show you how to mark up your book to kind of follow along with these coding guidelines. I still recommend that you go through and read all of them and become really familiar with them. So as you can see, the guidelines are super long, but what I've done is I've created these boxes around certain sections of the cardiac catheterization CPT codes to help me locate them a little bit better. So the first three codes in this section are for, the first code is for just a straight up right heart catheterization. Nothing else is done. The second code is for a left heart catheterization. Again, nothing else is done. No coronary angiography. So this is the code that is used when your documentation says that the patient had a left heart catheterization and there is documentation of left heart pressures. Usually what you're looking for in the documentation is an LV, V as in Victor, followed by some numbers, just telling you what those pressures in the left ventricle are. Along with this, you may also see aortic pressures, AO pressures, and that indicates that they took pressures on their way to the left ventricle. So remember, in order to really be a left heart catheterization, the catheter has to be in the left ventricle of the heart across the aortic valve. Another piece of documentation that you might see to support the use of this code is left ventriculography. And it does state that code 93452 includes left ventriculography when performed. So if you see that left ventriculogram, left ventriculography, or he might even document it as a left ventricular angiography, which is kind of a misnomer because angiography means, angio means vessel, and when they do a left ventriculogram, the catheter isn't in the vessel, it's in the left ventricle of the heart. So no coronary angiography, just left heart catheterization. That's 93452. And code 93453 is a combined left and right heart catheterization. And the documentation that you are looking for here is going to include things like they accessed a artery and a vein in order to get catheters to the left and the right side of the heart. You'll also be looking for documentation of left and right heart pressures. Additionally, on the right side, you're going to be looking for pulmonary artery measurements as well as heart output. So right heart catheterization usually have more stuff to it. They talk more about heart output. Now, having said all of that, we don't spend a whole lot of time on these three codes because usually, especially in a Medicare patient, they are looking at the coronary arteries. So that leads us to our second set of codes. And I wasn't able to box the first page of this or the base code, which is 93454, because of all of the pictures that they have on page 681 showing you the different types of procedures that can be performed. So, you know, this is an image of the right heart catheterization, code 93451. They also show it in an infant. You're probably not going to be assigning those types of codes much unless you code for a pediatric facility. And then they show you the left heart catheterization, which again shows the catheter. It's kind of a different heart view than we usually see, but this is the aortic valve right here. use a pen, you could probably see that better. This is the aortic valve here. You can see that the catheter has come through the aorta, past the aortic valve, and is resting in the left ventricle. And that's when they do that left ventriculography, and they inject contrast material directly into the left heart chamber. Now, code 93454 is kind of stuck on the bottom of this page, and I think that makes it challenging because on the next page, you're going to have a lot of baby codes for this parent code. And what this parent code is, and I've highlighted the important words in this section, or in this code description, it's coronary angiography. So placement of the catheter inside the coronary arteries in order to image them and find areas of blockage. Now, when you turn the page, all of these codes build on coronary angiography. So the first code is coronary angiography, then with imaging of the arterial bypass grafts. Free arterial and venous bypass graft. So if the patient has a lima graft or a saphenous vein graft and they imaged those as well as the native coronary arteries, those are the coronary arteries you're born with, then your code flips from, so rather than doing a 93454 for just the coronary arteries, the native circulation, then we switch to 93455, and we're looking at the native coronary arteries plus the saphenous, plus the grafts. So you could even write in here plus grafts. So our parent code says coronary arteries, and then this is plus grafts. The code 93456, coronary angiography plus a right heart catheterization. Extremely rare procedure because they're going to be doing a venous approach to get to the right side of the heart. They would have to do a left or an arterial approach, that's the big word I was looking for, to get to the coronary arteries. And I'm not saying it's never done, it's just pretty rare. Actually, right heart catheterizations in general are rare. Most of your plumbing issues you're going to find on the left side. Code 93457 is placement in the bypass grafts with right heart catheterization. So this is, whereas this one is just your right heart catheterization, 93457 is your bypass grafts plus right heart catheterization plus imaging of the native coronary arteries. Because again, these are all indented codes under that parent code 93454. Code 93458 is a common procedure. So this is now coronary angiography with left heart catheterization. So remember that in order to get to the left side of the heart, you access an artery and place the catheter into the, you can place the catheter either in the coronary arteries and or the left side of the heart by crossing the aortic valve. So if you have, and let me back up for a minute and say the documentation you're looking for to support these codes is imaging within the coronary arteries, and they're going to list them out separately. So they'll say right coronary artery, this is what we saw, left main coronary artery, left LAD, circumflex, etc. They're going to tell you what they saw. And then, like so much percentage of a blockage or whatever. And then when you get down into the saphenous vein grafts, again, they'll break that out. They'll tell you what they saw in saphenous vein grafts. If the patient has a lima graft, they'll tell you what they saw there. So what you're looking for a 93458, which is coronary angiography with left heart cath, you are looking for those left heart pressures that we talked about back here on 93452. And so documentation of LV pressures, documentation of a left ventricular ejection fraction, which is calculated off of the left ventriculography. So again, catheter in the left side of the heart, you're able to get pressures. That's your diagnostic left heart component. Code 93459 is also pretty common. So this is also including your left heart catheterization. And again, all of your left heart caths are going to bundle left ventriculography when it's performed, but this one also includes your bypass grafts. So the way these are set up, you can see you've got your baseline coronary angiography code here, coronary angiography with just grafts, just right heart cath with grafts, just left heart, or coronary angiography with just the left heart cath, coronary angiography with left heart catheterization and bypass grafts, and then code 93460 is a right and left heart catheterization. Not terribly common. I don't see this one very often. And 93461 is your combined left and right heart catheterization with your bypass grafts. So let me see if I can pull my, I should have this ready. So one of the references that we have available is this diagnostic heart cath tidbit. And this one probably looks different from what you've seen, a little bit different. Maybe just logos and copyright dates, but nothing has changed since we developed this. This one happens to be from 2016. So this cheat sheet shows you what is included in each of these codes. So remember the first three codes we looked at, 93451 through 93453, and we said 93451 was your right heart cath only. It doesn't include any coronary angiography, and left heart cath only. 93453 is a left and right heart cath, no coronary angiography. And then all of the coronary angiography codes that we talked about have stars in the boxes that they for the services that they include. So remember, our base code for coronary angiography was 93454. I shouldn't say base code. The parent code was 93454. If we add on the bypass grafts, there's the 93455. If we add on the right heart cath, it's 93456. So that's how this document is used, and I'll talk about the rest of this here in just a little bit. So let's go back to our book. You'll notice I drew an outline around these codes because those are all of the indented codes under this code here, 93454. And you could even write up here, you know, coronary angiography or parent code 93454 if you want that, more of that visual to help you find the code in the code book. So some of these other codes, we've got a lot of add-on codes that you may or may not use. And some of these I would consider to be for more advanced cardiac catheterization procedures that I've seen performed in facilities who do a lot of these procedures. So I'm going to skip over this section for now. I want to move over to the congenital heart catheterizations. And back in your coding guidelines, there is a statement about what is included. This is on page 679 in your 2020 Professional Edition of CPT. They talk about there are two families for cardiac catheterization, one for congenital disease and one for other conditions. And they say that anomalous coronary arteries, patent foramen ovale, mitral valve prolapse, and bicuspid aortic valve are reported with the non-congenital codes. So if you have a procedure where your diagnosis ends up as a Q code and it is not one of these four conditions listed, then you code it as a congenital heart heart catheterization. These are not terribly common outside of universities. Most of the people who have lived to adulthood, who are getting, well, I should say they're done in pediatric facilities as well, but people with congenital heart conditions are living longer now. So we are seeing an uptick in some of these procedures, but doing a heart catheterization on somebody with a congenital heart condition is a new subspecialty of cardiology, because a lot of them have had cardiac surgeries, multiple cardiac surgeries that has changed the anatomic structure of their heart, just repiped things and, did what they had to do in order to get the heart to work properly. So these are not codes that you are going to be coding very frequently unless you code for a major university or a pediatric hospital. But I have these boxed off, and it was kind of odd. There are 3 on the bottom of the page and there's 1 on the top. So I just drew a box around both of them and drew an arrow so I knew they were related, and highlighted the word congenital on each of those. So then I knew that, unless it's a congenital condition other than those 4 listed in the guidelines, that we don't code them separately. So the injection procedures, and this seems a little weird that there's this separate section. Long time ago, we used to code cardiac catheterizations. You would have a code for your the heart catheterization and a code for the coronary angiography. We'd have a separate code for the ventriculography, and then we had these supervision and interpretation codes that basically, it's kind of a dumb code, which is probably why they deleted them. There were 2 of them. Supervision and interpretation means that the doctor saw what was going on, he supervised the procedure, and he's giving you a report to tell you what he saw. And when I talked earlier about the documented heart pressures and, the physician, what he's going to see, he'll document what he sees in each of those coronary arteries. That's his supervision and interpretation. It's still a component of the coding. We just don't have a separate code. Well, when they changed the codes for cardiac catheterization, they kept the injection procedure section, which I think confused a lot of us. There are some of these codes that you're just not going to use very often. And I'll point out the first 2 codes in this section are for indicator dilution studies, and all you really need to know is these are separate procedures. They're never coded along with cardiac catheterizations. When they're done with cardiac catheterizations, it's just included in that procedure and not something that these codes are only assigned when this is the only thing that is done. Never assigned them before in my career. I've been coding, I've been coding cardiac caths for like 25 years, but have really been a cardiac junkie for probably the last 15, and I've never coded these. So we have the table in the book. I'll be honest, I never look at this table. I look at this. I think this is a simplified format, but let's skip over that. Let's go over to our injection procedures. And the first thing you'll notice about all of the injection procedures is they are add-on codes. So I've gone through and I have highlighted the important things. So this is the code for selective coronary angiography, but this is only for congenital. If coronary angiography is done for a non-congenital cardiac condition, your code is 93454. This code was developed to be an add-on code to our congenital heart catheterization codes. So if you have a patient who came in for combined left and right heart cath for their congenital anomaly, and you'll notice that we've got codes for retrograde. We've also got codes for combined heart through a transeptal puncture, and then codes for combined right and left heart cath through an existing septal opening. And what these mean is this first one, this retrograde, means that they made an arterial puncture and a venous puncture, and they placed catheters up each side into the left and right side of the hearts, respectively. The transeptal puncture means that they went in through a vein and got the catheter into the right side of the heart, and then punctured directly through the heart wall into the left side of the heart so they could get pressures there. When they do a transeptal puncture, they always go right to left, never left to right because of the heart pressures. So you would see just a venous approach for 93532, and you would see a venous and arterial approach for 93531. Code 93533, where they go through an opening in the septum, is for a patient who has a PFO. So they've got a patent foramen ovale, and usually, if you recall, that was one of the conditions we said is not considered to be a congenital. However, it usually it many times occurs with other heart anomalies. For example, patients with tetralogy of Fallot. Tetralogy means 4. They have 4 different separate heart defects, 4 separate heart defects, and one of them happens to be a PFO. So this code would be used if they didn't have to do that transeptal puncture, but they were able to just place the catheter through an existing opening in the heart wall. This patient would have just a venous access as well. So they would place the catheter up into the right side of the heart, advance the catheter across that PFO, that hole in the heart wall, and get pressures on the left side. Not super common for us who are not coding for big universities and pediatric hospitals. So these add-on codes, 93563, this was designed to be coded in addition to the code for the congenital heart condition codes. Same thing with the next two. 93564 is same thing. Actually, wait. Yeah, congenital. It does say congenital. So 93464. This is the same code as 93455. Same code as 93455, except now it's being done on a congenital heart. So this code is only coded in addition to the congenital heart codes. If you code it in addition to your 93455, you'll get an edit saying that you've unbundled the service. And 93565 is for selective left ventricular or left atrial angiography. And this code is bundled with all of your left heart cath codes. So this would only be coded in addition to your congenital, because all of your left heart catheterization codes, like the 93458, say that it includes left ventriculography when performed. So other codes that you will use commonly. So most of these codes on the injection side we're not going to use for our non-pediatric or our non-congenital heart cath patients, but the codes that you will use. 93567 is a pretty common code. This is for for supravalvular aortography, and this is specifically to evaluate the aortic valve. You'll see this done commonly for patients with suspected or confirmed aortic valve disease. It's always done before a TAVR, and TAVR is the transcatheter aortic valve replacement. They always do a heart cath before and I'm talking weeks before, to see if the patient is a candidate for TAVR, and they will evaluate the aortic valve that way. The other code that you'll see pretty commonly is pulmonary angiography. This is usually done with a right heart catheterization because that's how you get to the pulmonary arteries. So pulmonary arteries are accessed by placing a catheter into a vein, advancing that catheter up into the right side of the heart through the right atrium, right ventricle, and then the pulmonary artery. And they might call this, in addition to your right heart catheterizations, they usually do pulmonary wedge measurements. Don't confuse that with angiography. And so the measurements, the pulmonary wedge measurement is part of the right heart catheterization procedure because we're measuring cardiac output, we're measuring pressures. But the pulmonary angiography is where they inject contrast material into the pulmonary artery and then look at the pulmonary vascular system from that vantage point. These two, so the 93567 for the aortography and the 93568 for the pulmonary angiography, are pretty common add-on procedures for your heart catheterizations. So looking back at our tidbits tool here, the way that this is read, so you have your catheter placement in the light lavender on the left here. And this just shows, we've got catheters and we did imaging and or pressure measurements. If it's heart, it's pressure measurements. If it's, but it could also be, now that I think about it, left ventriculography is imaging. But you kind of get the idea of where your catheter is going to be. Now there are some add-on procedures. So this middle kind of medium lavender color includes add-on procedures that can be added in addition to either congenital or non-congenital cardiac cath codes, and if they're done. So, you've got the transseptal and the transapical puncture, and there is a separate add-on code for the transapical puncture. This is the same thing I was talking about with the congenital heart, where they go in and through a venous approach, go into the right side of the heart, puncture through the wall into the left side. But these are codes for non-congenital transseptal punctures. We don't see them done a lot in the cardiac cath lab. It's not super conventional. Where we do see this code used a lot is in the EP lab. And I'll do a separate little video on using those codes and walking through the CPT code book. So the dark purple here is all congenital. So if you're not coding a congenital case, stay out of the dark purple. And I would say these two sections are where you're going to be most frequently. So hopefully this video has helped to help you navigate your code book when it comes to assigning codes for diagnostic heart catheterization and looking at those different components. And I wish Ali the best of luck.